Hey, what's up guys, it's Shin here, and in today's video we're going to talk about rotator cuff tear injury and what you should be expecting at every phase of rehab and physical therapy after suffering a rotator cuff tear injury. If you're curious and if you're in need of a guideline that will lead you through the physical therapy process after suffering a rotator cuff tear injury, make sure you stick around for the entirety of this video. This slideshow and this video is based on the article that's mentioned here. I will go ahead and put that link in the comment section down below so you can go ahead and check that out too if you're curious. And it is by these authors listed here. So first of all, we need to know what kind of rotator cuff tendon or rotator cuff injury that you have suffered. And so mainly there's three types here. As you can see, the first type is rotator cuff tendinopathy, meaning it's mostly from repetitive use and that tendon has been inflamed, or it's a partial thickness rotator cuff tear or a small full thickness rotator cuff tear. And so in very simplified terms, these aren't as serious of a tear in its size. And so of course there's a lower risk of tear progression and then lower risk of irreversible changes. And yes, at this point, it's okay to try the non-surgical rehab or physical therapy because of those reasons. However, the second category here is acute full thickness rotator cuff tear or a chronic full thickness tear in adults younger than 65 years old. And so this is something that you see after a fall or for a table tennis player that's been playing for a long time that's younger. And so in this case, there's a high risk of irreversible changes. And so surgical treatment is recommended. And then you also have a decent likelihood of post-surgical healing. And so there's a good chance that the surgery outcome is going to be good. And then the third category here you see is the chronic full thickness tear in athletes older than 65 years or irreparable tears. These are more for older adults, and because of the risk of compromised post-surgical healing, surgery is not recommended in this case, and it would be wise to try non-surgical rehab or physical therapy first in this case. And so the non-surgical rehabilitation of rotator cuff tear injury is what we're going to be talking about today in this video. I have some pictures here for you to see. You can see that there's a tear in that supraspinatus tendon. And then you can also see the full thickness tear and partial thickness tear in that muscle there. So there's different stages of non-surgical rehab, right? If you're going to physical therapy, this is a good layout of what it's going to look like, most likely in this order. So what we're going to do in this video is dive deep into each category here: the acute phase, the recovery phase, the functional phase, and the return to sports phase. We're primarily going to focus on the acute and recovery phase because that's very important. And then the functional and return to sports, there's a variety of different treatment methods and ways to go about it, and it's very specialized based on your needs as an athlete, right? And so let's dive deep into the first phase here, which is the acute phase. So primarily the goals are to reduce pain and inflammation. You don't want to feel pain, right? And then we also want to protect the rotator cuff muscle so that it doesn't tear even more. And then we want to have full range of motion that's painless in order to move on to the next phase of rehab. And so those are the three goals that we want to meet in the very first stage, which is the acute phase. How do we do that? We modify the activity in a way that lessens the tear of the rotator cuff. We use physical modalities, using medications, and we'll go over all this and how this plays a factor. Here we go. And then in terms of the exercises, you want to progress it from passive range of motion to active assisted range of motion and active range of motion. And so passive range of motion, meaning someone's moving your shoulder, making sure that it can go into that range, and then slowly but surely you're putting more effort into moving your own shoulder. Periscapular muscle strengthening is strengthening the muscles around the shoulder so your scapula can be stable when you move your shoulder. And then there's other exercises that you can do in the meantime that'll help with the progression. And so low-level laser therapy, cryotherapy, therapeutic heat have some evidence for soft tissue injuries, according to this article here in the very beginning. So these are the physical modalities. Acetaminophen is generally the first line of defense for pain control, and then NSAIDs are considered with caution due to potential GI, cardiac, and renal adverse effects if the pain gets to be pretty bad. We also hear about steroid shots, steroid injections. That's also an option. Subacromial corticosteroid injection is considered to decrease pain, but a pain associated with inflammation, but also consider potential deterioration of tendons if you're using the steroid for a long time. So something to consider there. So once you've achieved painless full range of motion, and ideally that's the case, realistically, not always, you can move on to the next phase, which is the recovery phase. But before we move on to that phase, let's go ahead and take a look at some of the exercises that you can do during the acute stage of non-surgical rehab to progress your rehab stages. And so this is the shoulder abduction, where you move that left shoulder, and here we're working with the left shoulder here, and we're using a dowel or a stick for the right hand to assist that left shoulder into going up to your side. We also have the shoulder external rotation exercise, again focusing on the left shoulder there. We're moving the shoulder into that external rotation range. Shoulder flexion exercise is another one, sorry about that we can do. So raising your hand up and forward, right? Shoulder flexion using the dowel. Scapular protraction is you leaning up against the wall and then just lifting your shoulder blades apart there, utilizing that serratus anterior muscle that's responsible for protracting the scapula. So that's another one that you can do. And then finally the stir the pot exercise, where you just put your arm down and let the gravity pull you down, and then just stir the pot, is another good range of motion exercise. So go ahead and start there if you're in the acute stage. Now going on to the recovery stage of non-surgical rehab. This is after you've achieved painless full range of motion, like I said, ideally, not always. And the goals are to recover normal rotator cuff strength, normal flexibility, and basically correct the closed chain abnormalities, okay? And so some of the things that you can do to achieve those goals kinetic chain abnormalities, KCS kinetic chain, I apologize, are advanced periscapular muscle strengthening. Again, strengthen the muscles around the scapula and the shoulder, stretching, because sometimes stretching those pectoral muscles give us more mobility in the shoulder, which could translate to more strength. And then we have the strengthening exercises of the rotator cuff. So starting with isometric exercise, where we're not lengthening or shortening the length of the muscle, but just holding the position. And then moving on to closed chain exercises, open chain exercises, and resistance exercises with elastic bands, tubing, or hand weights are used to restore proper scapulothoracic mechanics to minimize dynamic impingement secondary to scapular dyskinesia. All this is really saying is you want your scapula to move properly according to how it's supposed to move when you move your shoulder, so that you don't experience any impingement symptoms. Scapular stabilization before aggressive rotator cuff strengthening is recommended. So all these exercises that I listed below are shown in the next slide here. So let's go over those. So this is an example of an exercise that you can do to strengthen the periscapular muscles. So row, right? Another one that you can be doing is called a no money exercise, where you're lifting your hands apart from each other so that you can go ahead and strengthen the muscles in between your shoulder blades. Quadruped protraction and retraction exercise, where you have your hands down and then you're lifting your shoulder blades apart and coming back down. So another good one. And then the prone shoulder extension exercise, where you're bringing your hand back as you're laying on your stomach to strengthen the posterior chain of the shoulder. So this is the recovery stage of non-surgical rehab. We're gonna now move on to the next phase, which is the functional stage. And so we still have similar goals here. The ways that we get to these goals are a little different, because now we can do a little more. And we want to make it functional, meaning it's based on your needs. And so we have freedom to do more, like we talked about. So multi-angle functional exercise, plyometric exercise. Now we're introducing power component to it and speed component to our exercises. Eccentric exercises, which has been shown to improve joint proprioception and increase collagen production, which is crucial in healing. And then return to practice. And so very specific things like throwing, serving, golf swings are gonna be important to keep in mind in this stage of rehab. And so, like I said, it's gonna be tailored to you as the person or the athlete based on your needs. I haven't included any examples of exercises because there are so many that you can do, and at this point it might be better to work with a performance physical therapist or a coach, because they would know the best about that specific sport, which is the same for return to sports stage, right? And so here you're really just focusing on return to throw, swing, serve program, and injury prevention program. It's going to be important to dose the right amount of sets and reps and practice time. So just something to note here, as of right now, return to full overhead activities criteria. So like serving in tennis, that criteria is based on function and symptoms rather than on isokinetic testing. So some room for improvement there in the future. So today we went over what non-surgical rehab for rotator cuff tear injury would generally look like. I hope you guys found that helpful. If you have any questions, please let me know in the comment section down below. Thank you.